have a few questions for you after you get a vaccine about, what it means to you or to docs here or something like that. Yeah. I'll say a few words before we get going, and
Yeah. Cool.
Yeah, thanks again.
Hey, Richard. How are you? Wow. Yeah, it's good to see you.
Super excited.
Yeah.
Cool.
What a day.
I know. I'm actually going to use a different microphone so we can take that one off real quick.
Of course.
Sorry about that.
No worries.
There's going to be so many different people speaking. I think it's going to be easier if I use my handheld.
Okay.
Can I get it?
Yes.
Yep. They're bringing the vaccines up right now.
Okay.
Cold store.
No, I didn't get it. Oh, my jacket, yes. Yeah, but they it's Schaeffer. Okay.
Yeah, it's crazy. So good morning, everybody. It's my great privilege to welcome you today to our first dispensation of the COVID-19 vaccine. Schaeffer is one of our fabulous nurses who's been on the front lines working in the COVID unit for many months since the start of this pandemic. And she's going to go first, followed by Dr. Ray Lee, who is our chief of staff, but importantly for this, one of our frontline emergency department doctors, also on the front line. I can't tell you how overjoyed I am. I'm Dr. Lawrence Neville. I serve as the Chief Medical Officer and Patient Safety Officer for the Columbia Network and PeaceHealth Southwest here. This is a day long in coming. This is probably the most exciting day that we've experienced or will experience over the long winter of discontent of the pandemic here. Our patients and our caregivers are very much in our hearts as we sort of embark on this noble first journey today. I want to just step back and remind everyone that this moment of joy comes in the midst of surpassing 300,000 deaths from COVID-19 in this country. This comes in the midst of having our caregivers and our frontline healthcare workers really feeling a deep sense of obligation, moral obligation to the community, and a deep sense of pride in what they do. But also they're getting a little tired. It is hard work, it's hard emotional work, it's hard spiritual work, it's hard seeing patients come in so sick, and it's delightful when we get to discharge them from the hospital. I want to thank everyone that's made this possible today, including all the folks that have been working almost literally around the clock to bring us to today and to allow us to start vaccinating. So I want to say just a little bit about where we go from here. So this is our beginning of vaccinating our healthcare workers, and that is to keep them safe on the principle of you put on your oxygen first and then you put on the oxygen of those beside you. So after we vaccinate our healthcare workers, we are going to be excited to partner with our community and making sure the community gets vaccinated. And even along the way, right now, we are going to be helping our community partners. So we are going to be working with Legacy Salmon Creek to make sure that they also get vaccine. We're working with the Vancouver Clinic. We're working with our EMS workers, our frontline ambulance and fire crews to make sure that they get vaccinated. And we feel really proud about that we can all come together as a community to do this. One more thing I want to say, and that is this is a bright day. This is a day that will shine really brightly into the future, and we're not quite there yet. So we're at the 1 yard mark away from the goal. Remember that we need to keep going, and we need to keep the energy up so that we can get through the rest of this pandemic. We are close. It will be a number of months, maybe 6 months or more, before the whole population that wants a vaccine can get a vaccine. So as we do that, it's really important that everyone keep up precautions, keep up masking, keep up social distancing, because that, in combination with a vaccine, is how we're going to get to the end of it. So with that said, thank you very much. It is such a joy to have you all here today.
Schaeffer, before you go,
Yes.
any anxiety about getting this vaccine?
I think there's just the general fear of the unknown, but I think as long as you're well educated and you understand that this is the next step in this journey, then I think there's confidence in that, and that helped me overcome it.
What's your role here at PeaceHealth Southwest, and have you been dealing with COVID-19 positive patients?
I'm here in our float pool, so I go to a lot of inpatient floors, but primarily the last, 8 months, whatever we've been dealing with this, I've been on the inpatient COVID floors, dealing directly with patients.
And I don't want you to speak for all your colleagues, but if you were to speak for your colleagues, do you get a sense of relief that this is finally here for you?
A general census, yes. I think it's, finally an answer to things, It doesn't seem like what we've been doing so far has been working, as numbers are getting worse, so I think this is a relief as to a step in the right direction.
How does it feel to be one of the first people around here to get it?
Oh, I'm stoked. It's great, and if I'm going to tell other people to get it, I have to get it, right? So I'm excited. I'm really excited. Yeah. Okay, thanks, guys.
Michelle. Manager here. Employee level for Columbia Network.
That's right, right. Yeah.
I did. He's not in here. He's not in here. Oh. Consent. We can. Okay. You don't have any issue about getting this done?
That's okay.
Okay. I'm sorry.
That's okay.
Okay.
I consent.
Okay.
Yeah.
Okay. We'll just wait for the vaccine. So there's going to be a 15-minute waiting period afterwards. Rivers in the area is normal. So the weather is normal.
Okay.
Anything that gets big on, that's an infection. If you get the area.
Sounds good.
While you're waiting up there, too, and you would recommend if you had any adverse reaction, let Ashley know.
Okay. Great.
While you're waiting, you need to fill out the application preference card. So this card will be your record and then you'll pick out your first name, your second name.
It's not getting first. Even know how it works.
When did they set that in there? They just set it in there?
Stealth.
Okay. Wait. You want to wait? I'm all ready for it.
Tell me when you want me to start. Like, you still, whatever, you do it. Whatever, I'll let you, it's fine. No, you're fine, just decide whatever, it's fine.
So how's it feel being one of the first?
Oh, it feels incredible. It's momentous. It's also bittersweet with so much suffering, sorrow going on, and to have this happening, it feels emotionally feels very intense.
Quickly after everything, all this started?
Absolutely. I think this is just an incredible step towards healing, towards getting our lives back to normal, and to have something like this in what is the darkest hour of this pandemic. This marks the turning of the tide.
What's it been like for you personally?
Oh, I think, like everyone else, it's been just emotionally very difficult and intense at moments. And I think being in an emergency room, you get to see all the sequelae of not just the COVID virus, but everything else that comes with it that's affected so many in our community. It's just been devastating. Okay, thank you.
about how much of a struggle it's been getting to this point?
It has been a struggle getting to this point. Our docs and nurses and physical therapists and respiratory therapists here have taken care of over 450 COVID patients since the start of the pandemic. We have increased our ability to take good care of them and to discharge them back to their homes, and we've still lost some of them. And I go out and round with our docs and nurses regularly, and I hear from them the emotional toll it's taken on them to see all the patients afflicted by this pandemic, and then unfortunately the few that pass away really are indelibly imprinted on their minds in ways that they won't soon forget. So a long journey to get here.
And now that the vaccine is here, I mean, some people are like, well, it feels kind of rushed. You know, ordinarily a vaccine takes years before it's ready to be distributed. You guys feel comfortable?
We feel comfortable and confident in the vaccine, and the reason for that is the technology behind the vaccine goes back to 2013. So the mRNA vaccine approach is one that's been long-standing and proven. And this particular vaccine has been tested in sort of unprecedented numbers of patients and volunteers, you know, well over 40,000, which is really remarkable for a vaccine trial. And then the data for safety for this vaccine was reviewed by multiple groups. So the FDA's advisory group, the FDA itself, and then the CDC has a group that looks at the safety for this. And then the Western states, we out here in the West, you know, are proud of our independence. We convened our own experts called the Western State Pact to look at the safety and efficacy data to make sure that we believe that this was the right thing to do. And we do believe that this vaccine is about 95% effective at preventing the spread of COVID, preventing somebody from getting COVID, and that the side effects, while real, are mild and go away in a day or two, and are probably a good sign if you get it, because it means, ironically, that your immune system is reacting to it and building up the immunity you need to keep yourself protected.
So now that we're here today and people are finally getting it, how does that feel?
It feels amazing. I mean, it's almost inexpressible with words, because you know, I have been with these folks, watching them as they do their daily work and trying to support the work that they do, and they are, again, committed to the community. They're committed to what they do. They've got a lot of resilience, and they are tired. So the fact that we can start keeping them safe means that they can focus on the community and their patients with less distraction and with more confidence that they can go into the future for the number of months that this pandemic will still be with us.
What about the public? What do you want to say to the public? Why should they not be afraid to get this shot?
So I would say a couple things to my fellow citizens. So one is that this vaccine has been looked at by lots of experts who believe it's safe. Our own docs and nurses have done their own research, and you can see, you know, we've got our physician, one of our physician leaders here being one of the first to get vaccinated, and he's doing that because he has looked at the data and believes that it is safe and effective. It's also looking out there and looking at what's happening in our communities. We know that the COVID rates are continuing to rise. For example, in Cowlitz County, our COVID unit there, you know, is up to 12 patients today. Up to 14 patients today. So that went from 0 to 14 over the last couple days since we stood up that COVID unit. So COVID is unfortunately real. It is out there, and when you get a chance to get the vaccine, please do. But like a lot of experts have said, it's really important in the meantime to keep up with masking and social distancing and hand washing, because that's what's going to get us through until we get enough of the population vaccinated.
All right, anything else you want to say?
Just, it's been a real honor to get to witness this today, and I really want to encourage everyone out there to please take this seriously, and please, we know the holiday season is here and it's going to continue for the next couple weeks depending on your traditions, and please be careful over that. because what we won't want to do is overwhelm the emergency departments and the hospitals, because then all of us potentially suffer. So please be careful out there, and we really care about you, and proud to serve the community.
Thank you very much.
Thank you.